This is CGTN, China Global Television Network. On today's World Insight, China doubles down on efforts to swing the doors open to travel and trade while optimizing a targeted response to COVID-19 cases. How well has it worked out so far? How can China work with the global community to better prepare for pandemics?
The thing is that we need to enhance the educational programs, because I realize that many of the individuals do not fully understand the COVID-19, the virus.
Here is our host, Tian Wei.
Hello and welcome to World Insight with me, Tian Wei. Since COVID-19 struck, China has weathered 5 pandemic waves. The nation has steered clear of widespread virulent strains and bought valuable time to research vaccines and treatments, as well as the preparation for the healthcare resources, according to Chinese authorities. The COVID-19 mortality rate in China have remained so far the lowest in the world. Taking into account a viral spread and the changing pandemic situation, China will downgrade its COVID management from Class A to Class B starting from January 8th, 2023. That is according to the Chinese authority. That means no more quarantines for arrivals and the easing of mobility restrictions. So how could China ensure a smooth transition to a new phase in its COVID-19 response? And how can China better cooperate with other countries to continue battling COVID-19? For answers, let's talk to our panelists. For more on the latest discussion related to COVID-19, we are joined by Dr. Kate Tulenko, founder and CEO of Corvus Health, Dr. Yang Hongjun, co-director of the Precision Medicine Professional Committee with Chinese Society of Biotechnology. He's now based in the U.S. Dr. Wu Zhiwei, director of the Center for Public Health Research with the Medical School of Nanjing University in China. Ladies and gentlemen, welcome to the program. Certainly, we have already seen signs of China already trying to shift from Class A to Class B in terms of regarding COVID-19, from pandemic to epidemic. Now, Dr. Wu, from your perspective, how do you see China as a country at different parts have been faced up to the challenges of the latest Omicron wave?
It was a tremendous challenge in the very beginning, particularly for the hospitals, pharmacies, and the general population as well. I think initially what people really facing a huge problem was that there was a panic buy of basic medicines like fever medicines, and also mucus clearance and the face mask, thermometers, whatever you could even, those are minor stuff. If you step into a pharmacy, often you're told that it's run out of stock. So I think this brings a problem that when people catch the COVID-19 infection, many of them flock into the hospital fever clinics, and many of them actually are basically do not need to go to hospitals. So initially in the hospital, they were completely overwhelmed by this huge number of patients. The other thing is that because the COVID-19 used to be under the Class A management, so the clinical procedures, admission standards are very different. So the hospital were basically caught off guard, and they have to quickly revise the whole procedure and admission standards to accommodate the new classification. So if you look at the hospital, initial few weeks, it was quite chaotic. But now you can see that they actually have quite standard procedures, and the situation is much, much better. So think it's critical that people do understand when they need to go to the hospital, when they simply could take some medicine, stay at home.
It seems that the medical workers in China are going all their way out in order to provide the service as much as they can on an individual basis, whether it's individual workers or individual hospitals, it seems. Dr. Tulenko, go to you. Observing from afar, how do you see this transition in China?
I think we need to be very careful moving into the Chinese New Year. And I think that China is going to need to put some restrictions during that time, because if we have the current management and the current set of rules during that period, and you have a large movement of people, I think that we could see really an explosion of new cases. So I definitely would recommend the government, putting restrictions on the number of people that could gather, for dinners or banquets. Because it's going to be a big challenge. We're seeing new, more infectious variants coming out, like the XBB, and we're seeing a lot more breakthrough infections. In fact, these variants, the existing monoclonal antibody treatments aren't effective against it. And of course, but people who've been vaccinated are less likely to get sick and less likely to be hospitalized, but they still get the infection.
When you say XBB, you mean XBB and XBB 1.5 in the US or in other parts of the world?
But it's rapidly expanding. Just to give the example, in the US, in 1 week, it went from about 14% to 40% of the cases. And with, increasing, flying and people moving around, I expect it to be in China and elsewhere very soon.
And also when it comes to festival travel rush, of course, this can be comparable, the upcoming Spring Festival, to the Western Christmas season. Holiday New Year season. So how do you see these factors going to play their roles in the future challenges of prevention and control, even though it has been adjusted from Category A to Category B?
It's not only the China, I think over the whole world, all facing the second wave of COVID-19 challenges. What I mean is, first of all, the Omicron came out last year in the middle, June and July. And that time, it have a certain surge there. However, the severity is not as much as right now. That's what I mean, the second wave, because this XBB is different from the original BA2. Sequence. So that now this new variant has very, very, very unique feature there. Transmission will very fast, and they have very strong binding capability with the ACE2 in our human body cells. So it's very difficult to have the, even you develop the new vaccine, you cannot develop it so quick. And also plus you have to have a clinical trial. Right now in US, it's, as Katie mentioned, that just 1 week from the 14% of the case surge to the 40.
Yes, infection rate high.
1.4 to the 40%, just 1 week.
Dr. Wu, go to you. On that, there are ways that we can help the public to prevent and control the danger of Omicron. But one of the most important thing is therapeutic treatment. That's what people have been talking about a lot. Paxlovid in some cities, for example, in the city of Shanghai, could be widely available now. In the city of Beijing, community hospital workers are being trained as to how to prescribe Paxlovid. However, in other parts of China, we have not seen much public information regarding how that is likely to be used and how much available the medicine is to the public. Now, as a researcher in the field, how much do you know about the availability and the function so far in the Chinese market?
It's good news that in Shanghai and Beijing, there are a large number of hospitals actually providing Paxlovid to patients. But I think that people have to be aware that Paxlovid has a lot of drug interactions with a lot of underlying basic medical issues. So as we indicated in various reports and media reporting, that does not recommend people to stock up with the medicine by themselves and do it by themselves. But China so far has licensed 3 different medicines, 2 from America, 1 from China, the locally produced. The other one actually is the Merck's Lagevrio, which also recently licensed. The Z medicine also is shown to be quite effective. And a locally produced one is called Asvudin, which also is licensed. And I think that also available in some hospitals. So who should take which medicine very much depends. They should consult their physicians in terms of safe usage and also to see whether they are necessary.
How do you see the general picture of this wave of Omicron from where you are? How much do you see that could provide you with some possible hints on the building of herd immunity in China as a result of this current wave?
Well, you see, you have to be careful with the herd immunity, and I think it's often people do misunderstood the herd immunity. They thought, okay, once I get infected, then basically I could simply lie down and go freely without carrying at all. This is a complete misunderstanding because for viral infection, the virus itself is a problem, but also your own immunity also is an issue. So it's a combination. Basically determines how serious you will develop symptoms, clinical outcomes. So, but you do have, a tremendous impact in terms of once you are infected, once you have vaccination. So we can see clearly that in China, over 90% of the population have received 3 doses of vaccination, so which actually provide tremendous protection in terms of avoiding developing severe diseases. So this definitely will help. But the one thing is that once the virus is mutating very fast, and basically if you look at the epidemiology, actually, you can see the virus evolves very quickly, in average about 6 months, which is a lot faster than you develop an mRNA-based vaccine, which at least needs 7 to 9 months. So basically, that tells us that you can't totally rely on vaccines and the medicines. You do need to use your common sense and do a certain kind of protection for yourself. So this is something actually we have to carry in mind.
The world is changing fast, taking all our lives with it. But we can change it too, by seeking answers to problems through discussions and debates. On World Insight, I ask direct questions to real people in the know, seek genuine answers, but respect diverse perspectives. Our live global debates tackle the most critical issues head-on. World Insight with Tian Wei go beyond the headlines.
Images may appear to be identical, but looks can be deceiving. The difference is not always obvious. It has to be discovered. There are always different sides to a story. We put the focus on the details. To see more, to understand better. CGTN. See the difference.
as we are facing ever updated global situation of Omicron, not to mention COVID-19, how much further thoughts should we give to the shift we have seen?
Exactly. This is not only about avoiding being infected. I think there is a high probability that everybody will be infected. The issue here is that if each individual provides some kind of self-protections, you could basically stretch out the peak of the infection, flatten down the curve. So that would ease the burden on the healthcare system.
I agree with Dr. Wu that I think herd immunity has been a little bit misunderstood or a little bit exaggerated, because herd immunity depends on how infectious the disease is and also whether you can contract it again and again and again. And with many diseases, you really only get it once, or you only get it once severely.
For example?
Oh, well, something like measles, for example. With COVID, not only is it highly infectious, but you can get it again and again. And so that renders herd immunity not as protective as traditionally we think of it being. So that's the challenge. And also, in a way, the herd immunity it keeps healthy people from dying, but since they're out, they can spread it even more. So it's not something that we can rely on. And I think we really need to start talking about a new normal, that, COVID isn't, we've been saying for a while that, well, COVID is going to become like the flu, but in the next 2 or 3 years, I think we're going to be in a situation that's worse. And I think that families just need to have a plan of how they're going to protect themselves, a plan of prioritizing what's important to them, for their economic health, for their mental health, and not doing the high risk activities that perhaps aren't as much of a priority. Because
when you say worse, what exactly do you mean?
I mean, worse than the flu, that in regular flu cycles, you get your vaccine and you're pretty much protected and it's not a problem. But I think with COVID, even if people are vaccinated, the virus is evolving so rapidly, as Dr. Wu said, that there isn't as much protection provided by the vaccines. And also, COVID is more infectious than the flu. So we're not getting the type of protection that we have in the flu. So we need to behave a little bit differently. We need to protect ourselves more, and we need to protect our family members and our community more.
XBB 1.5 is very tricky. Usually they can have the called immunity escape. So that time, even you have the vaccinated, and even you have these neutralized antibody, but they still doesn't work very well. So that's very possible you can have second infection or that case. So that's, I think, like the Dr. Wu said, right now, for these kind of serious virus and the pandemic, and you only the way you consider is two sides. One is how do you stop the spread of that virus. Second is how to cure these infected people. So that's the two sides you need to balance and you need to consider. And that's and also I think this is a new challenge, and even you have the Paxlovid and how to use that, and how to combine with the antibiotics, and how to use other medicine, how to use the different patient. Some is have the diabetes, some is pregnant woman. All these is different. All these need to be educated.
We have to be responsible for our own health, and at the same time take care of our loved ones close by. So that's a responsibility for everyone. Having said that, though, Dr. Wu, I would love to go back to you and discuss a little bit more about the shift we have seen, Dr. Wu, in China over the past few weeks. How do you see different levels, whether it is public health or public administration, the communities, as well as researchers and the national policy level are shifting their gear from so-called Class A to Class B, are shifting their gear from pandemic to epidemic. What should be play a bigger role as we continue our fight against Omicron? Dr. Wu.
I think that shifting is very critical. Basically, by shifting from Class A to Class B, either the prevention, intervention, the duty actually were basically given to the hospitals, to the individuals, and also to the communities as well. I think this is very critical. Our experience in the past 3 years of dealing with COVID-19 is that for the first 2 years, we had a tremendous success. We controlled the infection curve, we flattened down it and reduced the death of COVID-19. But once we had Omicron, the entire situation changed because the virus is so contagious you can't really clear it. But the infection is a reality. People starting to realize that the virus is likely to stay with us. So I think this shifting is very critical. Once the shift happens, I think the local community, individuals play a very critical role. The thing is that we need to enhance the educational programs, because I realize that many of the individuals do not fully understand COVID-19, the virus, how it is transmitted, what kind of diseases it would cause, what kind of medicine intervention approach people should take. I think this is something actually we need to expedite. We need to encourage the community to reach, to penetrate every layer of the community, let people understand. So this is very important. It's the public health education. And if we're ready to live with the virus, you need all this information adequately disseminated, delivered to individuals and family, and they could deal it by themselves.
Over the past few years, Dr. Tulenko, you and I, together with many of our panelists today, have been discussing how to provide a fair and a sufficient space for public health experts to spread the information, the right information, the closest to truth information to the public. But we have seen some voices have been silenced as a result of some harsh, harmful, and ill-oriented debates in the societies in different parts of the world. How much do you see that others could do in terms of governance to make sure that these voices will be heard once again, loud and clear?
Yes, that's been a big challenge globally. Just to use the example of the US, you've had quite a number of public health officials resign because their homes have been picketed. They've had, threats against their lives, threats against their families because of recommendations that they've made about masking or about closing schools. So it's a challenge. And as usual, all over the world, legislation takes a while to catch up to reality. We just saw actually this week, a New York State passed a law about fraud related to COVID and other emergencies, and making it easier for people to report fraud and increasing the penalties for fraud. And as far as protecting, public health practitioners, it's really very difficult because, they are by definition public figures. There's really not the funding to provide them with security. So I think a lot of that, of protecting them, really has to do with educating the public about why they're recommending what they do. But it is something that I think we will continue to struggle with. And this in the US is happening at a time even before COVID that we had a severe shortage of public health practitioners. So all that's happening now is just aggravating that shortage.
Dr. Yang, before we go, your thoughts on how should China at this point battle two possibilities. Is this wave of Omicron further escalate after the Spring Festival with a huge traffic flow? The other is to avoid a simultaneous round of XBB and XBB 1.5 that are now challenging other parts of the world, for example, North America.
I think you downgraded the COVID-19 pandemic. This is a good policy. However, it should not to stop you to take the new measure based on the situation. For example, the Spring Festival is coming up, and we should continue to avoid the big gathering and the big event. The whatever you open, you have the plan how to open it.
Gradual opening.
In a certain place, you should take don't worry about it because we now is downgraded the policy. But even that case, because right now the XBB is so serious, we should take this adequate measure to avoid these gathering and the public case, and people stay home. Still encourage them stay home.
Kate Tulenko, Yang Hongjun, last but certainly not least, Wu Zhiwei. Really appreciate it, and Happy New Year to you and your family. Thank you. And that's all the time we have for today. If you'd like to know more, search World Insight or check out our YouTube channel. Follow us on Twitter and Facebook. I'm Tian Wei on behalf of the team. Thanks for being with us. Bye for now.